Good morning, everybody. It's Wednesday, the 25th of August, and this is our COVID update for today. So we're going to dive right into the numbers and take a look at what's happening here. So the positivity rate here in Pinellas County has jumped again. We're now at 20.4%, and that's by laboratory testing. So if you think about the number of rapid tests, just how many, for instance, we're doing here at Regency Oaks. We were averaging over the course of the last week about 40 a day that we were testing residents and staff. So by the time you think about rapid testing that's going on in Pinellas County, on top of the positivity rate from labs, that true positivity rate has jumped to almost 30%. So instead of, remember last week we talked about 1 out of every 4 Pinellas County residents has COVID. It's now 1 out of nearly every 3 Pinellas County residents has COVID. So the numbers continue to rise. And so as we take a look at these numbers, there's not much of an argument to be made that we're going to see a reduction in this positivity rate in the near future. Next slide. So this is the 7-day rolling average, and we updated it from our last talk on Monday. In the past week here in Florida, this is updated for this morning. The new daily cases rose by 15%. The new daily reported deaths rose by 249%. Just a phenomenally high number. And then one of the positive things, because you know how worried we've been about the hospitalization rates, that actually fell by 1.3. Now, a part of that may be because there were so few beds available in Pinellas and Hillsborough County that hospitalizations are occurring outside of our immediate metro area, and so we're not capturing that in the data. Now, I don't have any statistical proof to say whether that's a 100% accurate statement or not, but that's sort of my speculation, is that's why with deaths rising, we're seeing a decline in hospitalization. It's because we're already at 100% capacity. So here are the updated numbers for the entire state of Florida. This is not our county data. Here in the state of Florida, 51.7% of the Floridians are fully vaccinated, with 62.7% having had at least 1 dose. And so you can see that first to second dose is that 21 or 28 day period based upon whether you got the Pfizer or the Moderna. And so you can see over the last 21 to 28 days, there's been a fairly good jump, maybe 9% of people going out and looking at the Delta variant and deciding that they were going to go out and get vaccinated as well. What this also doesn't capture is the number of people who got the first vaccine and elected for whatever reason not to get the second vaccine. And they say that that may be as high as 2% of that overall total. So improvement, but not where we need to be yet. So this is what we're looking at in terms of who is vaccinated in the state of Florida, and it's broken down by age. And so that far chart on the left-hand side is anyone over the age of 75, and the dark green is fully vaccinated. The light green is the partially vaccinated, first shot, waiting on the second shot. And so we've hit about 84% of seniors over the age of 75. It's 88% for seniors 65 to 74, and then this is where it starts to drop off. 50 to 64, it's 74%. 40 to 49, it's 65%. 18 to 39, it's 55%, and 12 to 17, it's 46%. So you can see where the older end of the spectrum is supporting and propping up the numbers for the younger folks who are struggling with making the decision on whether to get vaccinated or not. We are going to need the younger crowd in order to get true herd immunity. Herd immunity, which we originally had talked about being somewhere around 70%, we're now thinking that that number is actually going to be closer to 80%. And the reason for that is the Delta variant is so much more contagious than the Alpha variant, the original COVID. And as you'll recall, scientists are saying perhaps as much as 1,000 times more contagious than the original COVID. So you'll recall this is a slide from last week where we broke down the new breakout cases here at Regency Oaks and tried to share with you some of the contact tracing. You'll recall that we had a primary exposure. It's the blue circle down in the lower right-hand side of the screen. We had 12 individuals. That number later grew to 15. From that, we had 5 super spreaders, individuals who we were able to attach to other areas where we had an outbreak, and those became or led to secondary exposures. Okay, so this chart shows our outbreak in terms of the number of new cases on a daily basis, and you can see I have a timeline down there across the bottom. And so that first event was August the 6th, and if we go and count forward, 6, 7, 8, 9, 10, August 10th, that's 5 days after the exposure, right when you're expected to see something. Days 0 through 3, you may be symptomatic or you may not be symptomatic, but you are not a virtual shedder. In day 5, you start to shed, and that's when you become contagious. You are contagious from day 5 through day 8. And so sure enough, 5 days after the exposure, right as individuals began to be contagious, we started to see the spike in the numbers. And so we're looking at the first 6 days, and you see 3 on day 10, 2 on day 11, 3 on day 12, 1 on day 13, 1 on day 14, and then here we are on August the 15th. That's when we hit the 8. And so that was that darker blue on the left-hand side. That was sort of the results of the original spreader event that happened. And then we went a day without any new outbreaks. So on the 16th of August, we just didn't have anything. And then on the 17th, we started to see the results of the secondary exposures. These are the individuals that came in contact with a super spreader, someone who had been in multiple events, and we see the same or similar pattern. So on the 17th, we saw 2. On the 18th, there were 2 more. On the 19th, there were 2 more after that. And on the 3rd, there were 20. And if you go back and look at these similarities, you can look at this 5-day average. And so if you look at August 15th, the largest event, and then you look at the secondary events on August 20th, 5 days later, it is not a coincidence that the highest spread count in the secondary exposures happened 5 days after the high day for this outbreak. So on the left, we see the original spreader event, and then on the right, we see the secondary exposure. It's important to note that the first exposure was pretty widespread and severe in terms of its count. The secondary exposure was a little less. And then over the course of the next 4 days, and this is August 21st, which was a Saturday, Sunday the 22nd, Monday the 23rd, and Tuesday the 24th, we had 0 new outbreaks across the independent living. And so you may recall that we're looking for 5 consecutive days in order to be able to reopen and say that we have contained it. And so this is where I have a little good news and a little bad news. So this morning, if we had come in and had no new cases overnight, we would have had our 5th day and we would have been thinking about plans to reopen. Unfortunately, we had 2 new cases this morning, both in the independent living. And here's the good and the bad news. The good news is that these 2 cases are not related. Through contact tracing, we can determine with 100% accuracy that these are not related to the first 2 spreader event and secondary event. We know that both of the new cases are directly tied to family contact, and that continues to be one of the biggest concerns we're now facing is family contact. We just looked at the slide that broke down the number of people who are vaccinated by age group, and we know that it's the younger people who are not yet fully vaccinated, and that's posing the biggest risk. They have the highest mobility, they're unvaccinated, they are the high super spreaders. So the good news is it's not related. The bad news is with the 2 new cases, we want to start the count over again so that we can try to get 5 days. And so here's what we're going to try to do is look at getting Thursday, Friday, Saturday, Sunday, and Monday with no new cases, and then Monday be able to come back, and if that is the case, talk about how we're going to reopen and what those plans are going to look like. All right, so that's what all the graphs and charts are showing us, and I just want to real quickly take a look at specifically what's happening here at Regency Oaks. The number of individuals who are under quarantine, either because they had COVID or were under quarantine because a spouse had COVID, or we're tracking them because they are symptomatic but testing negative. So those are the 3 categories. We're at 17, but we have 5 of those scheduled to come off tomorrow. So the numbers are headed in the right direction. You'll recall that was in the mid-20s this time last week. So we've seen about a 50% reduction over the last 7-day period. In our skilled nursing, we have had a bit of an outbreak this week. Our skilled nursing is set up into general population. Those are our long-term residents, and then everyone new coming into skilled nursing goes into an observation wing. In our observation wing, we have had an outbreak of COVID. We have 7 residents who have tested positive in the isolation wing, and so that has caused us some concern. We believe that a couple of the cases came in from the hospital as positive. They had tested negative when the hospital sent them out, and we accepted them. They came to Regency Oaks, and that next day when we tested them, they had tested positive. That has always been one of the concerns about taking residents directly from the hospital. We feel like we've isolated the exposure over in the skilled nursing because it happened on the isolation wing. And so our standard of care is a little higher on the isolation wing than it would be, for instance, in independent living. Everyone who is a staff member on the isolation wing
is doffed and donned. That means they're wearing a gown, a mask, safety goggles, a face shield, booties, and so they have all the personal protective gear to make sure that they don't spread the virus from room to room, patient to patient. So we have tested all the residents and all the staff, and we got negative results. Our staff we tested yesterday, and we have cleared the staff. Everyone that's working has tested negative. We will do the residents a second time tomorrow. That's Thursday. And they will have had a positive test on Monday and then a positive test on Thursday to confirm that we've isolated and contained the exposure. So I think that is going well. I just want to briefly go back and talk a little bit more about mobility. Mobility is getting out into the public, whether you're going to restaurants or grocery stores or attending a sporting event or going to a movie. It's when you get outside of a tight, close, connected family or circle of friends and expose yourself to a larger population. Please be very sensitive to that, whether you're at a family gathering or a public event. If you are with multi-generational exposures, that's what we're watching for. If your exposure is more than 40 minutes, unmasked, indoors, those are the risk factors that we're looking for. You need to be very, very careful. You've seen how contagious this Delta variant is, and it's the exposure risk is not going to be amongst the vaccinated residents here at Regency Oaks. It's going to be from families, outsiders, and mobility going out and about in the community. So we will continue to stay on top of this and give you updates. Our next update will be Friday. And if you have any issues, questions, concerns, don't hesitate to reach out to myself or to Leslie or our wellness nurse. We'll be happy to assist you with whatever it is you need. So have a good afternoon, and we'll stay in touch.